Right now, NASA has a standard of acceptable levels of risk. So for acute effects, there's no acceptable level of risk, meaning we don't accept that, to allow astronauts to have any acute effects, which are, one type would be acute radiation sickness. So NASA needs to have in place procedures and shielding, warning systems to prevent any occurrence of acute effects. But for late effects, and cancer is the number one we're concerned about, we do have an acceptable level of risk. And this is similar to what's used on Earth base for radiation workers, where we allow some exposure, and the risk limit at NASA is set at a 3% probability of cancer death. So NASA, with approvals at the top levels of management within NASA, would allow up to a 3% risk of dying of cancer from a space radiation exposure. And this would be similar to what's on Earth. The one difference that's at NASA compared to Earth-based radiation workers at nuclear reactors or medical personnel would be that we're focusing on exposures over just a few missions. So the mission dose could be quite high compared to an annual dose for radiation work on Earth. So radiation work on Earth, their exposures and risk are managed by having a yearly limit, but assuming that the worker will work many years in that industry, 20 to 40 years in some cases.